When it comes to prosecuting a case, that examination is crucial evidence in the investigation. So to learn more, we turn to Terri Stewart, the Health Program Operations Manager at Harborview Abuse and Trauma Center.
The time with the nurse can be anywhere from about 2 to 4 hours, but patients, when they present to one of our hospitals through the Harborview SANE team, they are first seen by a social worker who sort of assesses their needs and provides immediate medical advocacy. And they're also seen by an emergency department medical provider to make sure that there aren't any more serious issues. So generally, patients should expect to spend between 6 to 8 hours in an emergency department when they present for an exam. This is the rack that we use to store the swabs once we've collected them. This is the Washington State Evidence Collection Kit. All the kits in the state are tracked under a state tracking system, so patients will know where their kit is in the process of being tested. And there are 15 different steps in the evidence collection kit, and what we collect is dependent upon the history that the patient provides, as well as the patient's preference and what they would like us to do for them at the exam. Everything is really determined by what the patient wants and guided by the patient's choices. So a police report is not required in order to receive the forensic exam. The exam, the medications provided, any diagnostic imaging that we need, and the evidence collected is provided free of charge through the Washington State Crime Victims Compensation Program. If a patient presents to the emergency department and wants a report to be made, they can be assisted by ED staff. Social workers typically will help them make a report, but again, it's not required in order to receive the services. The forensic nurses are really most interested in making sure patients get the appropriate medical care they need.